Well, earlier I spoke to the lead health negotiator for the Unison Union, Sara Gorton, and I began by asking her what her union and the others involved in the current dispute want to hear from the Health Secretary, Steve Barclay.
We've been really clear with the Secretary of State that what he needs to do is secure a commitment from the Chancellor to boost pay for the current pay year, as well as just talking about pay from April onwards. So the health service needs more staff if it's to get through the current workforce emergency. And one of the main reasons why people are leaving is for better paid and less stressful work elsewhere.
The reality is the strike action is only making the situation in the NHS much worse.
So firstly, it's difficult to see how the strike action could make the worst situation in the NHS's history could be treated as if it's responsible for that. So the hope of everybody that's taking strike action today and on the previous 2 days is that the fact that they are prepared to stand up for themselves, for the services that they care about and the patients they want to be able to look after much better, is that by calling attention to the dire state of the NHS, that they concentrate minds and people fix it.
But you do have to accept that strike action is having an impact. NHS data suggests thousands and thousands of patients' appointments are being hit by these strikes. We hear all the time of people waiting hours and hours for ambulances. How do you square that with the public? What do you say to the public about that?
Strikes have to have an impact for them to achieve the focus from the government that we want them to have. So what we've been, the situation that you see, every single day care is being compromised, and to pretend that it is the strikes that have been doing this, when actually that's the situation that has led people behind me to be, to want to stand on picket lines in freezing cold weather to try and challenge that situation. We are seeing across the board a workforce emergency.
Is the calculation you're making that this is a question of who blinks first? The government may make the judgment that if they settle with one union or one sector, they'd have to settle with everybody, and they simply can't afford to do this. If that is the case, how much longer do you think these strikes can go on?
We think there is a really strong economic argument for investing in the NHS. The economy needs people to be well in order for it to function. At the moment, the ONS reported late last year, we've got half a million people who are considered economically inactive because they're waiting for treatment. So investing in the NHS is good, not just to get the NHS back on its feet, but for the whole economy.
You'll be aware of voices saying, the NHS is functioning so poorly that maybe it is time to look at the whole way it works as a model and much more intervention from the private sector. Do you worry at all that the strikes contribute to that argument in any way?
I think if we hadn't got such a comprehensive set of data to show us, firstly, what the NHS looked like when it was properly funded, hitting targets, in ambulance services, being confident about every Cat 1 call being responded to in 7 minutes, handover times limited to 15 minutes at most calls. It is the funding and the staffing situation that's contributed to the kind of figures that you see now about call response times. So to pretend that this is easy to fix by going elsewhere to the private sector, I think is to underplay both the complexity of the NHS, but also the fact that they haven't actually tried the basic steps to fix it, of investing in the workforce, starting with a boost to pay.
Sara Gorton, got to leave it there, but thank you very much for talking to us.
Thank you.